Hey everybody, this is Dr. Joe Borio with Change Your Health, Change Your Life. I wanted to talk about a couple of problems or diseases that tend to affect and afflict thousands and thousands of Americans, and they're going to involve dementia or Parkinson's, Alzheimer's, multiple sclerosis. What research is showing is that many of these diseases now are linked or related to each other. And what they're showing is that there's a lack of flow of the cerebral spinal fluid that nourishes the brain and that flows down through the spine and essentially is absorbed down in the lower part of the pelvis. So for the average person listening to this, we don't really often think about it, but your brain and nervous system essentially float in a liquid, and it's called CSF, or cerebral spinal fluid. That fluid is made in the middle of your brain, and that fluid is filled with nutrients. It allows for proper shock absorbing, it allows for a cushioning of the brain, and it allows for the brain to basically give off some of its waste products or toxic waste products so that those products can be absorbed somewhere else outside the nervous system. Now, what research is showing is that the upper part of your neck, right here, the upper part of the neck, we're going to call those bones are called vertebrae, and those vertebrae, especially the top few, are critical in allowing the cerebral spinal fluid to flow out of the brain. And we're finding out now with research that if the upper vertebrae are out of alignment, what a chiropractor would call a subluxation. Subluxation. So there's a presence of something that's out of alignment or lost position. It prohibits or inhibits the fluid, the cerebral spinal fluid, to flow out of the brain, and therefore the brain starts to build up toxins. They're also showing there's small arteries and veins, and what's also known as lymphatics, that lie along the spinal cord itself. So when the spine is out of alignment, those too get pressed on, again inhibiting proper nutrition, proper toxins to be released from the brain. And we have to understand there's an accumulative effect. So what happens is it's kind of like if there was something, let's say, leaking in your basement, let's say sewage, you're not going to smell it right away. But boy, after a few days or a few weeks, all of a sudden you're going to start to notice that. Same thing as like a gas leak. If there was a gas leak, you're not going to notice it the minute there's a leak, but as hours or days start to pass, you'll start to smell it. You'll start to accumulate it, because the amount of that toxic chemical or gas or fume starts to accumulate. The brain is the same way. We have toxins in the brain that sometimes are from the environment, sometimes are things we put in our body or food supply. They start to accumulate in the brain. And by not allowing the brain and that fluid to flow properly, the brain and certain parts of the brain will start to die. And therefore the brain, those areas that start to die, they don't function as well. So in one person I might develop multiple sclerosis. Another person I might develop Alzheimer's or Parkinson's or dementia, because the brain is actually dying from a lack of proper nutrition and it's accumulating too many toxins. As a chiropractor, my primary concern is the flow of messages. So too when the spine goes out of alignment, it blocks the ability of your brain to talk to the body, like a computer would talk to a printer or a keyboard or a mouse or a monitor. And the same thing, those accessories to a computer need to communicate back to the computer. And if the spine's out of alignment, we lose the ability of those accessories in the computer to communicate, and therefore the machine's not going to work as well. You're not going to work as well. And we know when our body doesn't work as well, over time, again, not the day you feel it, it didn't start, but in many cases, it's 20, 30, 40, 50 years before you ever feel a sickness or disease or illness that's been developing as a result of some cause, as I mentioned decades earlier. So the chiropractor is concerned about the alignment of the spine first and foremost to maintain or restore some or all of the messages that flow from the brain to the body. The other concern we have is the blood flow that goes from the brain through the spinal cord. The other concern we have is the cerebral spinal fluid. Another concern we have is we know just through physics that if the spine goes out of alignment, the vertebrae rub, much like a car would wear out, if you will. The front end of a car would wear out, or an old hinge on a door doesn't work as well. The vertebrae, when they rub against each other, they don't work as well. that often we refer to as decay or degeneration that occurs in the spine. So my job as a chiropractor is to check those areas. And really the only person that's qualified and has the research to back up what we do is the chiropractor. We need to evaluate where the spine is in good and bad alignment, and if the alignment's bad, it's a subluxation, and that means we need to adjust. We're going to put pressure, very gentle but very specific pressure, on those vertebrae to allow the vertebrae to come back into better position. And over time, that's not something that's going to restore overnight because it's been out of alignment for many times years or decades. So much like braces on your teeth, a repetition of adjusting, a pattern of very specific adjusting to that area that's subluxated, done routinely over a period of time, will reduce or in some cases fully restore that subluxation, bringing it back to normal alignment, allowing the nerve function, the brain to communicate better, cerebral spinal fluid to flow better, blood flow to flow better, and the body mechanics of the spine to work better. Now the body becomes healthier. And then chiropractors are wellness doctors, so we're also very concerned about maintaining, if you will, or the wellness approach, always addressing the alignment before it even becomes a problem. That's really wellness, because your body then will often not only stay healthy, but often become healthier. Because your body, we forget that your body's actually recreating itself all the time. So your body gets corrected, and then it stays corrected, and the body gets healthier over a period of time. So as weird as this sounds, we actually are supposed to get healthier over time, not sicker over time. Something to think about. Guys, if this is something that afflicts your body, certainly, or you know other people that have those concerns, I would grab a telephone today and find, or an internet connection, and find a chiropractor that's close to those loved ones to make sure that they can get checked. Again, a chiropractor is the only one qualified to look for those areas of subluxation and correct them. And I certainly would do that today. For the rest of you who think everything's okay and are healthy, remember the best way to stay healthy is to take active care of yourself, and that way your body will always stay towards a more wellness lifestyle. Guys, this has been Dr. Joe Borio. Thanks for tuning in to Change Your Health, Change Your Life. Remember, you, your mother, your father, your grandfather, your kids, your uncle, your cousin, your co-workers, and everybody you know, not only in your community, in the country, from other continents, all the way across the world, should be under regular chiropractic care to ensure that their brain can communicate properly to your body. Guys, it's been Dr. Joe Borio. Have a great week. Talk to you next week.